Hi everyone, Jim Murphy for Elite Style Massage. So today I'm doing a video for you guys on golfer's elbow. If you've been getting any pain on the medial side of the arm here, so the inside of the arm down to this point on the elbow, you've got golfer's elbow more than likely. Tennis elbow happens on the other side of the arm, on the lateral side here on the epicondyle, where these muscles attach to that bony point there. I've done a video on tennis elbow separately, so I'll put it in the description in the link below. Because I don't want my videos to be too long, so I'm trying to keep them short, otherwise they get a bit too boring. So today we're going to look at golfer's elbow. I've never come across anyone that plays golf that's had golfer's elbow, or that's come to me with golfer's elbow that's got it from playing golf. It's normally from weight training, chins, deadlifts, any kind of rows or pulls. People that are throwing, people that do throwing events where you're sort of overstressing these flexor muscles here, because these are the extensors on the back of the arm here. You've got your extensor muscles extending the hand, and these are the flexors that flex the wrist and forearm there in the hand. So it's normally an overuse of the flexors, or an issue with the flexors. It could be a weakness, it could be where these muscles are just pulling so tight across this bone, this medial epicondyle there. So first and foremost, I always tell people, go and get a treatment. Go and find a good soft tissue therapist, sports massage as it used to be called. Now it's called soft tissue and remedial massage therapist. Go and get someone to get in there, do some really good work, soften up all these muscles, break up all these adhesions and these sort of fibrotic bits of scar tissue that can form, and really just give this a chance just to be in better, healthier condition. Then you can look at things you can do to help get rid of this issue and stop it from reoccurring. The problem with a lot of issues in the body is it's normally caused by something that you're doing. Now, if you are playing a sport or doing a job, you know, that's dictating that you're using your wrists and your arms in a certain way for extended periods, you are normally going to get issues that arise from it if you don't look after the health of your body with things like stretching and strength work. So there's two things that need to happen: stretching and strengthening. I wouldn't recommend trying to stretch a muscle that's super tight initially. Get some work done on it first, soften up these muscles, then look at sort of stretching them. Once they're sort of in a bit better healthy condition, then we can look at getting into a stronger position. I wouldn't recommend trying to get things stronger and working these muscles loads while this is inflamed, because the inflammation that happens there is caused by inflammation of the tendon being pulled across the bone too much, or just pulled against that bone too much. The tendon has to have a certain amount of elasticity anyway, but when it gets too tight and it's constantly pulling, it's almost like it's rubbing that tendon, and it can just cause problems with this inflammation. So ice is normally the best anti-inflammatory. 15 minutes on, 10 minutes off with an ice pack really will help reduce that inflammation. If you can take anti-inflammatories, they're also useful, and just get it to settle down. Then we can look at doing things like stretching. Now, before you try and stretch a muscle, if it's super tight, a really good technique to use is called positional release technique. So if you can shorten a muscle to its shortest point that you can, and just hold it like that for 90 seconds plus, it just makes the brain switch that muscle off, because it lets it know that it's in that position, doesn't need to be doing anything, and it just lets it go. So it's a really good thing to do before you try and stretch it. So if this lengthens the muscles and this shortens the muscles, you just want to hold that muscle in a shortened position. So ideally just push your hand down like that, or put your wrist and your hand on the back of a table and just push onto it. And you'll feel that just letting go. You'll feel this stretching on the top side, so you'll feel your extensors flexing, and you'll feel these not really doing anything. They'll just not be active at all. And hold that for 90 seconds, ideally to do 2 minutes, and time yourself. Get your time on the phone and time yourself, because it will seem like an age to have that longer time with it in that shortened position. Once you've done that, then we can look at stretching it. And the stretching of these muscles is pretty easy as well. So you just do the reverse. If you put your hand over and just either pull your hands down towards you like that, is a really easy one. Start off just without pulling your hand. Start off just by putting your arm out like that, and just push your fingers down towards the floor, and you'll feel straight away that stretching those flexor muscles there. If you want to give yourself a bit more resistance, you can, and you can just pull your fingers down. Another good one you can do, if you find that you're actually okay with that kind of stretch, is put your hand flat on the table. So your hand on a table like that, with your fingers pointing towards you, and just lean over onto it, and you'll feel that really stretching, and hold that again up to 2 minutes. So that's what we need to be doing to stretch the muscles out. Then we're going to look at some simple things we can do for stretching it. So I'll pop another video in now of what I want you to do with that. So what you're going to do is get yourself a bar, a bottle of water, a weight, anything that can just give you a bit of resistance, and you're going to hold it with a palms up grip and just let your hand come off the edge of a table or a bench or whatever you've got. And all we're going to do is a wrist curl. So basically you're going to let the weight drop down towards the floor and then just curl it up like that. Let the weight drop down towards the floor and curl it up. And when you do it, a little tip for you is get the little finger towards the ceiling. So you're not pulling it up like that. Ideally, you want your little finger up like that because I really want to focus on these flexors that are doing the work here. So that's one thing you can do. Do 3 sets, 10 to 12 repetitions. So do 12, 10 or 12, rest for 30 seconds, do another 10 or 12, rest for 30 seconds, and do another 10 or 12. I'll do that 3 times a week, so Monday, Wednesday, Friday, if you're in an office or at work and stuff like that. It's an easy thing to do. To make it a little bit harder and get a little bit of a grip exercise, grip strengthening going on as well, what you can do is at the bottom of the movement, roll it down to the end of your fingers, come back up and then curl up. And you want to do it for about 2 or 3 seconds going down, 2 or 3 seconds going up as well. So nice and controlled when you do it. You will feel it. You don't need to use a ton of weight for this. You will feel it, especially if you've had an issue with golfer's elbow. You'll probably find that these muscles are weak anyway, so we do need to strengthen them. So this is a really easy thing to do. Also, there's lots of other things you can do with stress balls or a rubber ball. Go to a pet shop and get a dog's rubber ball, that kind of sort of resistance, and do some grip strengthening work with it. Just squeezing the ball 10 times. Do that at 3 points throughout your day. That's just another good thing to help your grip and forearm strength. So that's one thing we can do for these flexors. Another thing we can do for one of the other muscles that does hit these quite a lot and that normally you find responsible for this sort of medial pain. So your arm and your wrist and your hands do various movements, okay? You've got flexion, extension, you've got pronation, supination. There's lots going on in the forearm. So another one we can do is if you get a bar and hold it like that, or a weight or a bottle of water again or something. And what we're going to do, you're going to basically if you're sitting like this, let your thumb drop out towards the floor that way. And then when you're pulling in, that's called pronation. Okay, so when you're pulling up this way, so this turning your wrist this way movement, this is a pronation movement that is going to hit your forearm where you're trying to work here. And again, just nice and controlled, nice and slow. So stretch down, count to 3, and then squeeze up, count to 3. Stretch down, count to 3. And squeeze up, count to 3, nice and easy. So again, a couple of little tips you can do there for strengthening the flexors. So a couple of useful things for you guys for strengthening and some stretching today. Hopefully you found that useful. If you know anyone that would benefit from this video, please share the link with them. And if you can like and subscribe to my channel, that would be amazing. Jim Murphy, Elite Style Massage. See you next time.